Hello, hello, hello. This is Truth Be Told. This is Dr. Walter Aka.
I'm Dr. Leroy Horton.
Yes, sir. We are back. We are back. We're trying to be consistent. We're trying to be consistent for everybody who listens. But Dr. Horton, you wanted to kind of touch base. You and I were just talking before we started recording about just the whole mental health situation in dentistry. We do a reactional video, and a lot of
Mhm.
people are contacting us saying it was great and everything, but most of it had nothing to do with suicide. I mean, he titled it
No.
that way, but 90% of it had nothing to do with suicide. But you know, dentistry is a very small brotherhood and sisterhood,
Mhm.
right? And so we want to try to take care of each other. We want to make sure that everybody's okay. And so we wanted to kind of talk about how important mental health is and how making sure that you're good, right? It's
Right.
not about the money. It's making sure you're available to serve the patients. You're available to serve your family. You're available to take care of your family, take care of your friends and everything. And if there's an issue that you may be going through, it's understandable. We feel alone sometimes because most people have their own practice and they're by themselves. They don't do group practices. And that's something that's good and bad about dentistry, right?
Yes.
And so, if there's anything that we need to do better is we need to communicate. We have a lot
Mhm.
of pressure. We have a lot of pressure when we're in dental school. We had a lot of pressure. We were in residency. We had a lot of pressure when we're working, right? You have a lot of pressure when you own your practice,
Right.
and I think the one thing we need to do is take care of it. I mean, just take care of yourself. Really do. And we, I'll say this. If you want to talk, please contact me. I'll listen. I promise you on that.
Right.
We will rather you be here so that you can, hate our podcast. That's okay.
Right.
But we'll rather you be here to hate our podcast than not,
Right.
So Dr. Horton.
Well, I think that vulnerability is often seen as weakness, especially amongst men.
Yes.
We're never really taught how to show our vulnerability, or we're made fun of on the playground growing up if we're vulnerable. And there's some social pressures there, but vulnerability is very real, regardless of gender, regardless
Yes.
of how you identify yourself. And I
Exactly.
think seeking help is, the same way we advocate for oral health.
Yeah.
I think we should all advocate for mental and emotional health as well. I've been seeing a therapist, twice a
Yep.
month.
Yep.
Mine started, marital counseling with my wife and I years before that. But then, when I lost my brother, I went through this really deep, deep, deep depression.
That's it.
And therapy isn't about necessarily just fixing everything all the time. It's also about
Mm.
maintenance. The same way, even
Yes.
if you don't
Yes.
have cavities, you don't have periodontal disease, we still want you to come in so we can make sure you're doing okay, so we can do your maintenance cleaning. It's the same thing with your emotional and psychological health. You have to be able to maintain it periodically to stay healthy, not only address things when they're unhealthy.
Yes. And I mean, honestly, thank you for even sharing that. You don't have to, but you chose
Right.
to. And we definitely appreciate you for that. I do believe that in the end, we have to take care of each other. No matter what, we have to take care of each other and we have to understand. I mean, we're the only ones to understand, right? People come to us saying how much they hate coming to us. That's not good. I don't care who you are. Consistent, negativity is gonna get to you, and so that's
Yes,
something that we have to just kind of understand that we all understand each other. We all know what we're going through, so we gotta just take care of each other. Okay, so
absolutely.
we'll end on that, but we wanted to kind of touch base on that, because we don't want people to think that because we did a reactional video on something like that, we take it light. We don't. That's not the
Right.
case at all. So,
Yeah,
but
absolutely.
today, actually, Dr. Horton was the one that kind of said, "Let's do this," because he said that he felt like I was triggered by this,
Got
and
triggered.
you know, uh, I was talking to him about how I feel like that the dental specialty itself in general is in trouble. I really
Yes.
believe that. I really believe that we're in trouble, and that's coming from a periodontist. I think that there's a lot going on that we aren't looking at and taking seriously. And I don't know if in 10 years there will be some specialists that some specialists or specialty that may not be here, or
Right.
very minute amount will be here.
Right.
And so I wanted to kind of go. This is my therapy session. I wanted to kind of go over this with you and throw it out there and see what your thought process was. Okay. And I'll
Right.
start with the one we both know, which is perio.
Okay. Yes, sir.
Perio, I believe, is in big trouble because general dentists are doing what? Implants. They're
Hmm.
doing implants. They're doing extractions for implants, right?
Right.
Implants, based on the numbers, it's the highest return on investment per your time. right? If you place an implant, you may charge 15 to 2,000, and it might take you what, 30 minutes, if not less, right? Yeah. And so the return on investment per your time is very, very high.
If it's successful.
If it's successful, and that's very true. Okay, so let's put it this way. This is my opinion, and everything is based on success. Everything I'm going to say is based on success. And so dental dentists have realized that. Dental implant companies have realized this, right? Because there's maybe, what is it, 20 to 30% of dentists or specialists, right? And then there's like 60 to 70% are general practitioners, right? And so if you're a dental implant company, what would you rather go for, the market that's 60 to 70% or the 10 to 20 to 30%? I mean, that's just math.
Yeah.
Implants started, right? But Brennemark started implants, and he basically said it was only for oral surgeons. Then as time went along, it became, okay, oral surgeons and periodontists. Then the implant dental companies basically said, wait a minute, we have a whole other avenue that we're not tapping into. Then they started advertising to general dentists as this is another way of making money.
Right.
Another means, an easier means. If you listen to this guy or this person or this company, then you will do it and you'll make a lot of money. And just like with anything in dentistry, a business is a business is a business.
Right.
So they came in and they started doing it. Now, I'm not going off of success rates or anything at all, right? Because we still don't know. But you'll see that just like with anything, the more people that drive in a town, the more likely an accident is going to happen.
Right.
So the more people that place implants, the likelihood of what? Failures and so forth, right? Yeah. People act like failures just happen. No, it's been happening. It's just it wasn't happening at an astonishing rate, but now it's happening, right?
Right.
So dentists placing implants. Dentists not really understanding perio, and I'm not, and you can maybe speak on this, but the comprehensive evaluation, being able to see a patient for the full mouth and being able to understand perio is very limited. They see it as you have bone loss, you go into the periodontist.
Right.
That's if they decide to go that route. A lot of dentists, and I'm gonna make these generalizations based on my opinion. So I don't need anybody adding me or anything. I don't care enough to listen to you, right? But a lot of general dentists, okay, and don't forget, just like with any specialist, we base a lot of things on referrals.
Yes,
that's how we make a living. People refer to us and we do the work, right? A lot of dentists will say, hey, we're doing the scaling root planing. Let's just bring you back every 3 months and maintain that. The numbers may be high. Patients may not be getting better, but we'll just keep doing the same thing. And I don't think it's malicious by any means. I just think it's comfort, right? As a hygienist, I'll speak for hygiene. As a hygienist, you just did this case, and maybe you charged the patient $500, $600, $700, $800 because you did laser and you did irrigation, you did all this stuff in this area, and you told the patient this should help, and it didn't help. There's no way anybody's going to feel comfortable then saying everything I just charged you didn't work, so now let's go to this guy who's going to charge you more
to possibly redo some of the things that we
already charged you. Yeah. And so it's not malicious, but this is what's happening. To the point where I went to a conference, and the one breakaway session was how to buy general practice offices so you can control for your referrals. If that does not scream help, if that doesn't scream you're in trouble, I don't know what does. It wasn't have a party with your general practitioner. It was, how do you buy them out so you can control the referrals?
Right. Now, let me ask you this before we get too far into it. Do you think that breakout session was more of a business session, or more of a, hey, we need to do this to save the integrity of the specialty session?
It could be both. And the way they were speaking, it was both. It was, this is good business sense, and this is also good because now you can teach the associates that work in there how to refer properly, how to diagnose properly. That's exactly what it was. It was, I control for this because whenever the associates come in or they're working in my office, I tell them this is what you look for. I tell the hygienist this is what you look for. So now we've basically taken it out of the perio practice, and now we're now saying, hey, hygienist over here that works for me, I need you to basically look for this, this, and this, and send the patients to me.
Right. Right.
So
But let me ask you this.
it's both.
So in school right
Yep.
now in residency,
Mm-hmm.
there's this term called perio jail.
Uh-oh.
Right. And I don't know if you heard this back when you were in residency.
Okay.
Essentially, the pre-doctoral patients can't get phase 4 treatment. So they can't do crowns, implants, any of that stuff, permanent partial dentures and so forth until they're cleared from perio. Right. So
Okay.
nothing. So let's say you've got a 6 or 7 millimeter pocket up here,
Mm-hmm.
but you just had a root canal done down here because it was an emergent, and you've been stuck in this provisional for a year and a half because you have a 6 millimeter pocket up here, right?
Right.
And so I think what happens is, and I think there was something similar going on when I was at the University of Washington, where you kind of had to get cleared by perio for major restorative.
That makes sense.
And you get kind of jilted as a dental student because you're like, Jesus, perio is controlling my life right now, right? You know, A, they're kind of arrogant. They think they know it all, right?
Right.
But B, every time I want to get to the juicy stuff, the crowns, the bridges, the dentures, some periodontist is telling me, no, we need to get 0.5 millimeters of attachment here first.
And it all and that 0.5 literally matters to just us.
Right.
No one else.
Right.
People will do research for that 0.5, and it matters to no one else. None.
But I say that to kind of get to the point of when you graduate, you already have a disdain for perio. I feel like perio academically has done itself a disservice because of its academic culture. Now, I tell you, most of the periodontists that I met when I was practicing that were, you know, practicing real life periodontists, not academic, not the most wonderful people in the world.
Right.
They were fun, they were joyful, they were not arrogant. But academia has this way of attracting a certain ilk of person, right? And so I'm sitting there as a GP and I'm thinking to myself, well, am I going to refer this to the periodontist who's going to propose $10,000 worth of SRPs, gum grafts, and all that, and also tell the patient that, hey, there's a likelihood that, you know, you shouldn't do anything else until you get this done.
Right.
And now I've lost all this potential income.
Right.
Where I'm a reasonable GP, I can do the stuff that I think is needed and maybe hold off on the stuff that's not as emergent until they do finish their periotherapy or they see their periodontist. But there's a lot of people that are like, you know what? The periodontist, you know, I'm bitter. I'm jilted. Right. I'm just going to do SRPs and I'm going to do 3-month perio maintenances and get this crown and bridge work. So do you think it's something that maybe perio helped create?
Yes, absolutely. It like you said, I mean, even when I was a resident, I didn't want to do perio because I was like, oh, I have to go ahead and get this probe in depth, and then I have to make sure that this person doesn't have one spot of bleeding, because if they do, I'm going to need to give it to the perio, resident. They're going to need to tell me all this other stuff, and of course, they're looking to do something, so they're going to be like, oh, you need this, this, and this. And if you're in private practice, this, and this eliminates all of the patients' 1,500, which we've already established sucks.
Yes.
Right. So the 1,500 is gone. And then you come back to me as a general practitioner and there's nothing left. And so now that crown that you needed, you're like, wait a minute, I can't afford that. My insurance doesn't cover that, or I don't have enough. Right. So it's not the GP's fault per se.
Right.
It's how do I put this? It's ignorance, but it's almost kind of like catered or crafted ignorance. It's basically, you know what? I'm going to pretend that doesn't exist.
That doesn't matter.
because guess what? I care about this a little more.
Right.
And that's what's happening. And is it good? I don't think so. But do I blame them 100%? No.
Right.
Right. But then the funny thing is also, if you try to teach them, they may or may not listen. More than likely, they won't listen because they listen to their pocketbooks and say, again, if I send this patient for this, this, and this, and I'm not speaking about everybody, by the way. There are a lot of good GPs, a lot of good general practitioners that are very, very good. I'm speaking about what I'm seeing, what I'm seeing. It's, oh, let me take care of myself first. Because there have been times where patients literally have horrible perio disease, tons of bone loss, and they come to see me for a consultation. They're like, oh, I just got a brand new crown yesterday. And I'm like, who thought that was a good idea to put a crown on your tooth when I'm
Right.
going to do all this stuff? Because the funny thing is, if you do agree to do my surgery and you end up having recession around that crown, then you have to either get that crown redone or pretend that recession isn't going to bother you, because it's
Right.
going to happen, and then you're going to pretend that that's what's going to happen. So now you may have to redo that crown, or the general practitioner is going to be like, oh, the patient's upset because now their margin is showing because they have recession. I'm like, well, you did a crown right before I was going to do surgery.
Right.
It happens,
Yeah.
But
Yeah.
that's why
But here's a
I think
question.
Perry's in trouble.
I think so too. But I think what happens is the more the economy contracts, the more the insurances lower or stagnate reimbursements, the more everybody's looking for a way to stay afloat.
That's it.
Right.
That's it.
And so that's where you have the GPs maybe looking at the other way, or maybe not probing as hard. Right. Everything today is 3, 2, 3. Right.
Turning the blind eye. Oh, that doesn't.
Right.
That's not there.
Right. Or they're trying new things. And to be honest with you, when you said that, the implant companies started expanding their market, right? So they started looking at general dentists. Well, you also have to look at the ancillary industries that open up around that. So now you have labs that do design, surgical guide design, 3D printing.
That's it.
They can get you as a general dentist from A to Z digitally. You don't have to do anything except this right here. We'll do everything else for you.
That's it.
Right. And so as a general dentist, you're thinking, oh, hey, this is the way I can increase production.
This is easy.
This is easy.
This is easy.
And so I think there's these market forces that are pushing GPs towards doing more and more endo. And then the technology is evolving to make it easier and easier.
Oh, I mean, absolutely.
I was at the NDA convention. I think I mentioned in our last cast, they had one of those Yomi robots on display.
The robot that does the implant pretty much for you.
Yes.
It basically holds your hand and tells you where to drill. It's amazing. Right. I thought it was great. I think I sent it to you. I was like, yo, look at this.
Yeah.
I was like, our job is done.
Yeah. Yeah. But think about it. The only reason your hand has to be on it is for medical legal ramification reasons.
That's it.
Technically, your hand shouldn't even, they have the capability to do it without your hand on it, but it has to be doctor driven.
That's right? It. That's it.
And so it is going to be interesting to see how each individual specialty is able to stay alive or adapt. Maybe this is just the calling to say, hey, you've been doing this for the last 30 years, time to grow up and change.
That's it.
And that's where I think, and we talked about this before, we're going to go not only from treating patients for the first time, but retreating patients from what other doctors have done.
Absolutely. And I think that's something so our solution is you either adapt or you learn to treat complications. And I honestly believe that especially is going towards treating complications, because the slam dunk, large space molar implants, they're gone.
Right.
Give up on that. Move on with your life. They're gone. Focus on something more difficult, immediate implants, aesthetic zone, get good with soft tissue, get good with stuff that makes you the surgeon that you're supposed to be.
Right.
Okay.
Right.
That's my one.
Or buy them out.
Or
buy them out.
Or buy them out. That's another. But now you're dealing with DSOs and they have deeper pockets than you do.
They do, but I tell you this much. So, and you might have experienced this as a traveling periodontist, is now that I've sold my offices, but I was experiencing it a little bit before as I had affiliate offices I did implants for. I got such a good relationship with the GPs there. And I'm there once to twice a month. They literally text me cases and pictures and, for feedback and guidance on a daily basis.
Right.
Whereas I don't know if you can have that type of relationship with 40 referring doctors.
Right.
But if you can have 4 or 5 offices, and hey, if you happen to have a stake in them, that's even better. But now, like you said, you get to control the education of the GP, the referral process, and the patient, doesn't have to leave. They don't have to go
Right.
to someone else. That trust is always stays in house.
So that actually brings me to another reason why I think perio is going down.
Okay.
And mind you, I'm a periodontist, but
Right.
the reason is because a lot of perio, when they graduate, a lot of periodontists, when they graduate now, are doing that traveling perio.
Mhm.
They're not going and working with another periodontist. They're doing a lot of that traveling. That's what I see. Again, this is all my opinion. This is what
Right.
I'm seeing. I'm seeing a lot of people doing the They may have their own offices, but they're still traveling. They're still
Right.
going to GP offices because they've basically been now educated and trained to say, hey, why don't you just come to my office and do the work? Why do I
Right.
need to send a patient out? Because patients don't really trust anybody else but me, that kind of stuff, right?
Right.
And I say
Right.
that facetiously, but it's true. They will basically tell the patient, oh, well, I have a person coming into my office. Oh, that's great. Oh, it's so convenient for patient. But really, patients were traveling to periodontists and oral surgeons all the time. It
Right.
wasn't, and I mean, it wasn't like you would send them to like the next town. It was like, oh, the periodontist is right across the street, or the periodontist is within a good range where I can send them. You never wanted to send, unless you knew this periodontist was that special. You don't send them more than maybe 5-10 miles away. So
Right.
it wasn't that much of an inconvenience. But now we've said, oh well, you don't have to go anywhere but to my office.
And I have to push back on that a little bit because
Go ahead.
when I had offices and I had relationships with neighboring offices that would send their implants to me,
Mm-hmm.
I used to have to make it very apparent to the patient and to the referring doctor that I would never poach a patient.
Right.
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 But patients would often ask me because they thought I was a specialist because why are you referring to this guy if he's
Another
not a
guy.
specialist,
Yeah.
right?
Right.
And then as the conversation would come up and they would say, oh, wait, so you guys do like root canals and crowns here too? And I say, yeah, we do. And they're like, oh, well, then why don't I just come here?
Mm-hmm.
Why do I have to travel back and forth between offices? And that's
That's
where I would have to say, well, actually, I do have a relationship with your referring doctor and an agreement that I can't, I can do your specialty treatment. I can do your implants. That's what they referred you for, and that's it.
Right.
I mean, they understood. But I think there is especially in American culture, there is a sense of seeking convenience and expediency.
Right. But
And one-stop shopping is like the norm for everything. Like you go to Amazon, one-stop shopping, Costco, one-stop shopping, Target, get groceries now,
And I guess my argument is, was this something that we taught patients, or is this something that naturally happened? Does that make sense? Like to me, I think it's just like with anything, right? Everybody was fine going to Walmart, getting in your car, driving to Walmart, right? Then Amazon came along and said, hey, we're going to disrupt this. Right. And I truly believe that if we kept it where you were going out to the specialist, patients they wouldn't know any better.
Right.
That's what I've always done. Then we basically said, okay, we're just going to have the specialist. The specialist might have said, hey, I want to come to your office and do it. So now we've set a new standard of this is what is normal. And so we're basically making it easier for the patients, but are we making it better for dentistry? I don't know.
Yeah, that's a good question. I mean, I think anytime anything evolves from the status quo, people that are used to what was always have a hard time adjusting, right?
That's it.
Talk about the good old days, right? And the good old days are changing, and a lot of us will get either hurt in that adjustment period or that transition, or we'll learn to evolve, or some people will just retire out of it because I mean, think about it. If you're in your 60s, do you really want to now put in all this extra time to learn social media marketing and the digital age, or do you just say, okay, I've had my time. I don't want to start from scratch.
Yeah,
because this stuff evolves especially technology. It evolves so fast. It's hard to keep up. But you're right. I think that the old days of just having your boutique clinical practice is kind of over. You have to be mobile, and Amazon did that to us, right? Everybody wants everything to come to them.
That's it.
And I think that culture translates across all industries and mediums where it's expediency, it's immediacy, and convenience is almost put above competency, quality. See,
now you're saying some other stuff. You're saying some other stuff now. Okay. I didn't even want to get into that, but you're saying some other stuff. Okay. Second, let's do endo. Let me tell you why I think endo is in trouble.
Okay.
Endo is in trouble because people have learned implants. People have learned, patients have seen, all on X and teeth in a day and all this other stuff.
Right.
Endo's in trouble because there was a Netflix documentary that went very viral.
I remember that.
Yes. Why root canals are horrible for you. That
Cause
tooth is dead.
cancer,
Yes, that tooth is dead. You get cancer, you get all kinds of random stuff, right?
chronic
Right.
inflammation,
It's been
all that, yeah.
debunked, but it does not matter.
Right.
If somebody learns something on social media or it goes viral on social media, no one ever does any more research past the 5-second TikTok.
Right.
No one goes and does any other research. There is
Right.
no legitimacy to that document document movie, but no one has done research to actually find out what is the truth.
Right.
So patients now think, you basically are keeping a dead piece of me in my body, right? That's what the documentary said. Second, patients and general dentists who refer to us again, remember, want implants.
Right.
And I'm not speaking for everybody, but a lot of them want implants because this is what happens, right? They get the root canal, patient will get a root canal, and they'll say, oh, it was horrible. I was in pain. I was feeling everything. So now you've already kind of skewed the whole entire idea of a root canal. And then research shows that root canals are very, very successful. 90 some plus, right?
And most actually don't
When done
involve,
right.
yeah. Yeah. Most of them don't involve pain
At all.
except for the people that wait too long. Right?
That's it. Right.
Yeah.
So we know this, right? But again, patients' perceptions are their perception.
Right.
It was painful. And then, I had to go get a crown, and then I got the crown, and then that tooth fractured and broke anyway. Right. I had a patient today that actually had a root canal, had a crown. Okay, the crown was beautiful. The root canal was wonderful. There was a fracture. And I said, man, have you ever considered getting a night guard? Because you really broke this tooth. And he's like,
I was just gonna go there.
Right. The response was, yeah, that's not me, man. I'm telling you, man, that root canal, that's what happens. It breaks. I looked it up and it breaks. And I was like, that's not how it works, but okay.
Right.
But I'm not going to convince him because, again, right, this guy got a root canal. The root canal broke or the tooth fractured. So he automatically associates with everything else. And I'm not sure what the dentist or whoever said to him, but they come to me for an extraction, bone graft membrane. And I'm like, bro, you might want to look at everything else that's going on because you have other root canals, root canal treated tooth, right? That need to be careful. And I think a night guard and so forth. But perceptions are perceptions.
Right.
So not only do GPs want implants, they want, hey, your tooth hurts, let's take it out and place an implant. And that goes both ways. That goes for periodontally involved teeth. That goes for decay teeth. Let's get an implant in there. Right. Everybody's excited about implants, so therefore, let's get an implant.
Right.
Patients have been educated to think implants are better.
Right.
Why do I need to go through all this pain when I can just get an implant? You got people on TikTok talking about, let me just take out my teeth and let's place, implants and tooth in a day, and I'll get my whole smile and everything like that. I mean, I can show you different TikTok. This girl literally is 24, 25. And she's shown us everything on TikTok, her whole rundown of taking all her teeth out and getting implants and then getting the overdenture the hybrid.
Right.
Okay. So they're glorifying losing teeth.
Right.
I don't know why.
I
don't know why.
I think part of it, honestly, there's a certain mystique about anything that's considered high tech. And implants has been marketed as this high-tech solution to an old school problem that everyone always suffered with.
That's it.
Right. And you're right. So, I mean, the truth is that the most fractured teeth in the mouth are the root canal treated teeth.
Right.
Right. But that's not a causal relationship. Just saying. That's it. Right. And so you're right. Is there also periodontal disease? Is there also parafunctional habits? Was the restoration or the crown placed in its proper occlusion? People that have a lot of root canals and crowns have a lot of root canals and crowns because they haven't established a healthy, good pattern of taking care of their teeth over time. Yeah. Right. So there's all these factors, and teeth are, how many hundreds, if not thousands of times do you chew or bite down in a day? Right. There's a lot of road work that goes on these teeth that you're expecting to last a lifetime.
That's it.
But the truth is, a implant is that much more sensitive to those external factors than a
It's not
natural
a, it's not a,
tooth is.
yeah, it's not a miracle. It's not a miracle
It's not, but
product.
we've done a bad job of educating
Yeah.
patients. This notion of titanium, intuitively you think, oh, okay, well, titanium is stronger than a tooth,
Metal.
right?
Yeah. Yeah.
It's metal. But we've also been sold a bill of goods for years where,
Okay.
in my vocabulary and talking to patients early on, I would say things to the effect of, you can get a lifetime out of this,
That's it.
right?
That's it.
I would add the caveat, if you take care of it and we see you for your
Right.
maintenances, you could get them, so you kind of use softer language like
Right.
could, not will,
Yeah.
and so
Right.
forth.
But they hear what they want to hear.
They hear what they want to hear. And now, the more I dive into obviously the residency and seeing complications, is I take that completely out of my vocabulary. There's nothing you do on the human body that's for life. And I
That's it.
think me and you have talked about that
Yeah.
before.
I always
Nothing
tell
on the
it.
human body is for life.
I always tell everybody, I'm like, listen, you buy a car. Do you expect that car to last you the whole time? No, no,
Right.
you don't. After 3-4 years, you're buying a new car, right?
Right.
Why? And the funny thing is that car you might drive 20% of the time
Right.
in a day. 20%. Teeth you use probably 60 to 70 to 80% of the time.
Right.
Okay. And you expect that one to last you a long time. That makes no
Yeah.
sense.
Yeah.
That makes absolutely no sense.
And the kicker is, when you get into the nerdy science of it, when you look at the definition of success from Albrechtsen, right?
Mhm.
It's no more than 1 to 2 millimeters of initial remodeling in the first year.
Yeah.
And then the caveat, no more than 0.1 millimeter of progressive loss per year after that, which means if you get at a young age, like you said, the young lady that got in her 20s, it's expected and it's considered normal to lose about a millimeter every 10 years.
That's it.
Now, if you got in your 20s and now you're 50, 60 years old and it's only a 10 millimeter implant, you've lost 60% of your bone.
That's it.
By the time you're in your 60s.
We don't tell them that.
We don't educate.
People don't educate or talk about that, right?
Right.
And then here's the last part about endo that I think makes me laugh, because I see this so many times. It's, whose fault was it when the root canal was done, the crown was placed, and then we basically have the root canal that has failed?
Right.
Is it the general dentist's fault, or is it the endodontist for not doing a good job? Is it the dentist for not sealing that crown so that you can't get contaminants going in there? Or is it the endodontist who didn't do a good job at the beginning?
Right.
And this is the problem. So the only person that's stuck in the middle is the patient.
Yeah.
Right? One person is blaming this. One person is blaming this. And the patient's going, I don't care. It hurts.
Right.
Fix it.
Well, listen,
and you wonder why they don't want to do another root canal or retreat.
Endo knows they're in trouble. And I'll give you a little anecdote. So where I live, and I'll try to keep it vague so no one.
Yeah, it's fine. You don't have to even do that. Just where you.
Very renowned endodontist. Very renowned. High quality work.
Yeah.
But also the type of endodontist that charges $2,500 for a root canal.
There it is.
Right.
Yeah.
I think 2 or 3 of his kids also endodontists. Work out of the same clinic. He puts on these big courses out in Arizona. I mean, the skill level at this clinic is high end, because this is someone I shadowed early on, right? Before I went to dental school. But his son asked my business partner to train him in implants. So my business partner, because we all got a good relationship, said, sure, I'll show you how to do implants. So he showed him how to do some implants. I think he also showed him a sinus lift. One day, a patient was sent out for a root canal, came back with a implant.
There it is.
And I kid you not. So endo even knows that at some point we get away from what we know clinically and academically and scientifically, and we bend to market forces.
That's it.
Because theoretically, there should be no reason that a doctor that's getting a referral would not even communicate with you, but would say, oh, you know what? No endo, implant, no perio referral, no OS referral. I'll just do that myself, right? Because they're bending to market forces, and unfortunately, we're all affected by it. But I think a lot of endodontists do see the writing on the wall.
That's it.
Because of the way things are going.
And if insurance starts to cover implants the way they do endo, it's a wrap.
Yeah,
it's a wrap. It's done. Yeah. It's done. Okay.
Right.
Third.
Yes.
The next one that I think is in trouble is ortho.
Yeah.
Ortho, I think, is in big trouble. And I
Yeah.
think the reason for the same exact thing. General dentists are saying, why would I need to send this kid or this person to get braces when I could do it myself, if not better? With
Right.
what, you may ask? Dr. Aka, with what? Thank you for asking. Invisalign and aligners. The
Yes.
gentleman that we did the video reaction
Mm-hmm.
is doing 2 days of general dentistry work, but then
Right.
the rest of his time, he even said, is now a consultant for clear aligners,
Right.
teaching general dentists how to make more money by doing clear aligners.
Right.
Who used to do alignment, but orthodontists.
Right.
To the point where orthodontists have now, like I'm talking about dive right in, and they're
Right.
doing more probably aligners and do more, clear Invisalign and work
Oh, you
with
talk to any of them,
Invisalign.
it's like 50%
Yes.
of their practice now is clear.
Yes. And so
Yeah.
the funny thing is, I actually looked 2 weeks ago. Invisalign, Align Technologies, the ticker symbol, basically reported the most profitable quarter it has ever reported.
Okay.
The stock shot up like 20%.
Right.
People are using them and then some.
Yeah.
We need to be honest and say, orthodontists, you're in trouble, and you know you're in trouble because aligner companies. Okay, I have a friend of mine who stopped dentistry. She's young too. I'm done with dentistry. My back hurts. Is now working with an aligner company to teach other general dentists about aligners and also to do what? Answer any questions that they may have.
Right.
So she's become basically a consultant for them.
Right.
So that general dentists, general practitioners can actually do alignment and Invisalign and straightening teeth easier.
Right.
And the technology has gotten so good that most people don't even need to go through regular braces anymore. The stuff that you thought you couldn't do, you can now do. And it wasn't like that 10 years ago. I remember that.
You can, but let me give you some insight on that. This is, I don't know if I come off as a hater. If I do, let me know.
No. I want you to, because I'm already done enough hating today.
So the young man that we did the reaction video on,
yeah,
he told us about his whole practice experience up to like the more recent present time, right? At no point did he mention aligners.
Right. You have to go and look into it, by the way.
Right.
Yeah. So that's what I did. I was like, let me find out, make sure that I'm not speaking ill will of somebody.
So now he's a consultant for aligners, teaching general dentists. He's still young though. Yep. So I would argue he hasn't even been practicing aligners long enough to see cases through, to see cases that don't work, to see cases that need adaptive, revisions and so forth. So what they did is they took a young guy that looks marketable, that speaks well, because obviously, I mean, he's doing well in this chat. I know he's very articulate.
No one's going to say bad about that.
Yeah. He becomes the face of something that he doesn't necessarily have an expertise on. But he can go through a PowerPoint slide and read what the experts have written for him to say.
That's exactly.
And so that's A. So that's me kind of giving it the context.
No, you weren't hating.
For anyone listening.
Yeah, you weren't hating.
But I did aligners when I was a GP. And this is what makes it easy. You scan the teeth to take impressions. You have a company like ClearCorrect or Invisalign who have orthodontists and technicians on their staff that plan the case digitally. They send you the digital video of the step-by-step process. You present it to the patient.
I want you to pause. Yeah. I think you said something that I don't want anybody to go over. You're not even doing a treatment plan.
No.
Somebody else, an orthodontist or somebody else is doing the treatment plan for you.
Right.
So imagine if you wanted to learn how to drive. And they said, oh, no. Sit in the passenger seat. I'll drive you around. But then I'll basically give you the credits of driving.
Right.
So that's basically what you're doing. You're basically just getting the credit for what other people's work.
It's cheating. It's plagiarism.
No, I want to make sure
clinical.
Everybody hears that. I want to make sure everybody hears that.
Right. Yeah. It's clinical plagiarism. Right. Someone else has designed this grandiose plan, given it to me, and I said, yeah, I like that plan. let me give that to my patient. And because it's my patient, that's my license that's attached to it.
That's it.
Not this consultant.
That's it.
Right. One thing that I feel like ortho has in its favor, though, is that aligners take really good compliance.
True.
And we all know most patients are not that compliant, right?
That's it.
So that's why when they sell you the packages, you can either buy the limited package with Invisalign or Clear Correct or any of the other ones, or you buy the full extended one, which allows unlimited revisions for up to 5 years, because there's already a built-in expectation. The patient's going to do good for like 3 or 4 months or maybe 6 months, and then they'll fall off, and then you might not see them, then they'll come back, then you have to rescan and start over, and you can nickel and dime the patient that way, but then you don't have to pay anything else to the company because it's all included for 5 years. So they already know there's going to be this recidivism when it comes to aligners. And where I fear is that there was not one case that I ever sent out that the aligner company said they couldn't do. Not one. But what I was doing, I had a friend of mine that was an orthodontist, Dr. Kashner, who's an amazing orthodontist. And then my business partner does, he got his fellowship he's not an orthodontist, but he got his fellowship in orthodontics.
Right.
I would always run it by them, say, hey, listen, this is what this company's telling me. Do you think this is a reasonable case to do? And there were some cases that are like, no, there's no way that you can do it with aligners. Don't even try it because you're going to be married to this case for the rest of your life. But
you just said something that a lot of people don't have, is somebody tell them yes or no that knows more, right? Because we're gonna role play real quick. Ready? I'm somebody trying to sell you a liner, right? I'm the clear liner company, or I'm the clear liner company. I'm gonna come to you. I'm gonna say, listen, Dr. Horton, do you want to make an extra $50,000 a year, a month, a year?
Ooh, of
right?
Course.
Yeah, of course, right?
Yeah.
So. And how much work do you want to do? What if I told you only have to do maybe 5 minutes worth of work and you can charge a patient $5,000?
You get me all hot and bothered here.
Come on now.
Talk to me.
Talk to me. Now, all you have to do is trust that we're going to look out for your best interests.
Okay.
And if there's any problems, we have a 24-hour hotline. You can reach us at any time. We got you.
Okay.
So don't worry about it. You don't have to ever refer any of your patients out, because we all know patients like to stay in-house. They want to trust you because they've built a relationship with you.
So far, so good.
Right. Yeah. So I want you to understand that what I'm going to give you is going to revolutionize your office. Your assistants are going to get on board. We'll train them because we'll send them to a course and they'll learn how to do our system the best way they possibly can. And you'll go to a course, and this is going to be a team building effort. Okay, your team is going to get together and they're going to say, oh my God, they're going to come back and we're going to be excited because we've learned something new. We all have.
Right.
Okay. And now, not only is your office going to make more money, if your team does good, you can also give them a little something to say, hey, thank you, team, for working so hard for us.
Right.
Come on.
Yeah.
Now, why would you not want that?
Oh, you had me at $50,000 a month. That's all you got to say.
Right.
The rest is just icing on the cake.
So there is not a single thing that you actually even looked up to make sure that I wasn't BSing you on.
Exactly.
It all sounded good.
Exactly.
And that's exactly what happens. And they don't have somebody in their ear that says, oh no, you can't do that. No, that's not a good case. No way you will ever get the results you're looking for.
Right.
Because when they send you the animation, it looks like it works.
Right.
But it's not.
Let me ask you this though. Let me ask you this, because what you've done is painted a good picture of how the companies kind of usurp the orthodontist and all their clinical training and understanding of tooth movement, biology, and so forth, right? And said, hey, here's a quick cookie cutter way you can kind of treat everybody.
That's it.
We'll do that. Okay. Have you seen the same thing in perio? And I've got something specific in mind. But have you seen something in perio, non-implants, that's very similar to that?
Yes. Lanap.
Okay. Thank you. I knew it was the same thing.
It's Lanap is the same exact thing. And if anybody watches or watched previous episodes, they know how much I despise Lanap. But that's another story for another day.
Right.
And the reason why I despise it is not because it's not something that works. The research that shows that it works. It's just a matter of they dumb it down to make it seem like everything can be treated with this. It's a magic wand where you have bone loss around implants, Lanap. You have your jaws missing, Lanap. You're losing your hair, Lanap. You you can do everything with this laser.
Right.
Everything with this laser, and that's, I mean, that you got me going off, of course, but
real quick though.
But that's what they're doing. It's like, why would you not? And people don't vet all the BS that comes out of these salespeople's mouth.
They don't, and this is where if I ever knew that there were so many scams in the industry, not to say that these companies are scams, but the process by which they bypass someone having to understand, the long, hard-fought processes of the science and literature that built it is, we were offered our Lanap training through our school, right?
I'm sorry, my little one came in. Yeah,
oh no, it's
she
fine.
doesn't care that I'm doing anything.
She put her on camera, man.
Yeah. then we'll never get on topic. No. Go ahead.
But so they said, we'll try and get you guys Lanap trained before you graduate. And I'm thinking to myself, oh,
that's great.
This is going to be some extensive training to use this laser that we see in these presentations, cure everything. Extensive training. Mm-hmm. It's 2 weekends.
That's it.
You telling me I could have not gone to 3 years of freaking residency for $100,000 a year, and done this in 2 weekends?
Oh, don't get it wrong. The machine and the training is going to equal to $100,000.
Oh, that part is.
You got to forget that. No, the money is still there. You're still going to spend $100,000.
Right.
It's just a matter of the time.
Yeah.
The time is different, Yeah. And it's funny because I've gotten so many emails and so many phone. I went to one dinner. Mm-hmm. They came and they were like, oh, we want to invite you to this, and it was a really nice like steak restaurant. I'm like, come on, man. I think this was when I first came to Houston. You know what I mean? I'm like, hey, free food, say less. I'm there, right? Ever since, and this is 2014, I've gotten emails consistently from reps talking about, oh, we're having another dinner. You want to come and check it out? And we really think you would do very well with this laser and this laser and this and that. And I'm like, I usually send an email back. Please stop contacting me. I don't want your machine. I don't want to deal with you. And literally, it'll go for like a year, and then another person will contact me. I'm your new rep for your area, and I want to invite you to this dinner. And I'm like, please stop contacting me. I don't know who you need to remove my number from or my email, but you need to talk to everybody. Stop, But yeah, so that's another reason why. And again, the ease to do ortho, the ease for general dentists to do ortho, just like the ease for general dentists to do implants, just like the ease for general dentists to do root canals, right? Because don't forget, they've gotten simpler and simpler and simpler root canals to the point where you just put one drill in there, one file in there, and you're done.
Right.
It used to be multiple appointments, multiple techniques. You were coming in a different
hand
angle.
files, rotary,
remember that?
microscopes,
all different angles. You're checking stuff, and now you just one file, and you're done. It's magic.
Right.
And people have accepted it, and they said, "Oh, if it's that easy, why do I need to send out to the endodontist?
Right.
Why do I need to send this out to a periodontist if I can do my implant? Because there's a lab that basically has used the CBCT, which is a great product, and has basically said, hey, this is where you need to put the implant. All it takes is for you to do this and you're done. Or why not use the CBCT, get this machine, this robot that holds, or I hold its hand. And then
you put your arm on it like this. It doesn't work.
That's the only thing that's missing is a date. And then you basically just drill and it tells you where to go and you're done.
Yeah.
Technology has made stuff easier, but I'm not sure if it's made it better.
Right.
Hence the reason why those three, perio, endo, ortho, you're in trouble.
Right.
You're in trouble. And I'm speaking to myself and my colleagues, you're in trouble unless we figure out how to change. I could get into why oral surgery is in trouble. I can get into why pedo's in trouble. We're gonna stop there. Maybe the next episode we'll get into why the rest are in trouble.
Listen, pedo needs to change his name, because I don't know if it's just me. When I hear people say, I'm a pedo doc, I'm a pedo this.
Right.
it just has a bad kind. It just takes me back to Chris Hayes or Chris
Oh,
Hansen.
oh
And
goodness.
it's like,
Have a seat.
I think that they
Have
need
a
they need a
seat.
rebranding and take that word back.
That's you can get on that. But I'm gonna wait till the next time where we can talk about why I think pedo's in trouble, why I think oral surgery, and you would have thought that I would never touch oral surgery. I think
Right.
oral surgery is in trouble, right? And then overall, I think dentistry is in trouble because there are a lot of deep pockets coming for dentistry.
Mhm.
And we talk about this through the DSO model,
Right.
where we have corporates, private hedge funds, private, millionaires, billionaires basically invested in these companies to make sure that we basically get rid of the mom and pop dental offices and we go as group entities, and you are under one company who is basically just there to make money.
Well, it's the economy of
Dentistry,
scale,
it's economy
as
of
you know.
scale.
It's economy of
So
scale. But
yes,
let me ask you this: where do you
yeah.
see? Because we're talking about dentists doing specialty work,
Mhm.
right? And there's a lot of nuance to that.
Mhm.
But you also see in certain states, hygienists can own offices.
Yes, in
Here
Canada.
in Portland, there's a outfit called Gleamery where you just go and you get cleanings.
Okay.
There's no doctor. You go there, you get cleanings. They do whitening, they do protective.
I'm gonna do this. I'm gonna do this. We're gonna stop there because
Okay.
I want to. This how you do podcasting. Okay.
Yeah.
You
Yeah.
leave something.
Okay.
Leave crumbs.
Okay.
We can't just give them
Because
everything.
this is good stuff. We're getting deep now.
We can't give them everything. We can't give them everything because if they do, I promise you they'll stop listening to us.
Right.
So we can't give them everything. We got to hold on to the next episode, right?
Gotcha.
We're gonna get antsy. So next time we're gonna talk about why a lot of the rest of the specialists are in trouble.
Yeah.
And then we're gonna talk again about why dentistry overall is in trouble because now we're allowing a lot of stuff to happen that maybe shouldn't be happening, or maybe it's
Right.
good, right? Maybe
Right.
it's good. Hygienists owning their own offices. We have
Denturists.
denturists. There's so many things going on. So we'll talk about all that. We'll go into that. But brother, I mean, I'm tired because I felt like this was a lot of therapy.
Well, you were triggered, man, and that's why I knew I had to come on today. Because when you texted me, for context, you texted me about 4 different topics in the span of like a day. And then this morning, the one you sent just sounded frantic. You were like, bro, dentistry's in trouble. We got to talk about it. And I was like, all right, man, I got your back, man. Whatever you need.
See, one thing that people don't realize is we're always brainstorming on ideas for this,
Yes,
right? Because
sir.
we're trying to educate as much as possible. But yes, I went to work and I was like, we're in trouble. We are in trouble so much because I see so many things that people send me, right?
Yeah.
And the funny thing is every day, all day now. Like now, one of the hygienists, really, really, really good hygienist, and she's wonderful. But she she keeps sending me stuff on TikTok because she told me to get on TikTok, and I finally did because I hate everybody knows I hate social media. So even my friends were like, "You're back on social media?" I was like, "Yeah,
right.
It's for the podcast only." But she keeps sending me stuff, and I mean, I don't know if TikTok is good or bad or it's just a cesspool, but man, it really triggers me on a lot of stuff that's on there. I'm like, how was this even allowed to be on there? Like the level.
And why is it so popular?
Yes.
You see the most false information
and it's going
by some attractive person that's animated, and it'll have like 10 million views. And you're
I'm
like,
trying to figure out, and that's what I mean. I'm like, I look at it, I'm like, that's completely wrong. And I think she's getting to the point where she enjoys doing this to me because she'll send it to me and then she'll have like a laughing emoji, and I'm like, okay, so you're basically doing exactly what my brothers have been doing for a long time. It's basically trying to get, because they know when it comes to dentistry, I get triggered, I guess. So so you educated me. I get triggered.
Let me mess with Walter. Let me send him an oil.
Right. Yeah. It's like, okay, hey, how do I get him mad? Oh yeah, oral pulling. Let's talk about that and say that it replaces period. Excellent. But actually, that's another topic we can talk about, oral pulling. I had a patient that we'll talk later. But I had a patient that actually asked me about oral pulling. I had to look into that myself.
Yeah, let's deep dive into that. Yeah.
But man, hey, honestly, thank you for taking the time, as always, brother, to come on and entertain me and my craziness. But we will connect again, man. Thank you, everybody, for listening. We really appreciate it.
Yes, indeed. Thank you, everybody.
We always say the same thing, man. If you guys have any questions, please email us audio, email, or even video. We would love to have it. It's real dentist with an S at gmail.com. Real dentist, REAL dentist with an S at gmail.com. Just email us, man. We'll answer it. Promise.
All right.
All
God
right,
bless
guys.
you. Good night to everybody. Thank
Good
you.
night.
All right. Take care, bro.